Welcome to the Organic Instinct Health and Wellness podcast, where we dive deep into the insights of living a healthier, more vibrant life. I'm Daria Kuchikali, your guide on this journey towards a holistic health and well-being. Here at Organic Instinct, we believe in the power of nature, the wisdom of ancient practices, and the advancements of modern science to create a balanced, nourishing lifestyle. Welcome to today's episode, where we're joined by Kamile Midwife, a highly experienced and dedicated midwife and nurse with over 7 years experience in the field. Kamile is also an international board-certified lactation consultant, a role she passionately embraced for the last 5 years. As a mother of two, she understands the demands of her both professional and personal life, bringing a unique perspective to her work. Kamile's career began in the hospital setting, where she spent 3 years honing her skills. Today, her focus is on providing women-centered care, offering education and support through pregnancy, labour and the postpartum period. Kamile's commitment to empowering women during these critical moments in their lives makes her an invaluable resource for anyone navigating the journey to motherhood. Welcome to the podcast today, Kamile.
Thank you. Thank you for having me.
Wonderful to have you. And I'm sure so many women are going to be tuning in today, and maybe even their husbands.
Yes, hopefully.
Hopefully, because we want them on board
yes,
as well.
Exactly, yeah.
To learn more about empowering women with all their birthing decisions, a healthy pregnancy, and the importance of the postpartum period, which I feel I only appreciated with bub number 3 and 4. With number 1 and 2, I felt I just needed to be superwoman. I needed to get up and cook and clean and look after a baby and go back to work after a few months, which is insanity. And as we've, wisened and matured, and people like yourselves who have been following and listening to and getting advice from, we notice, hang on a minute, we don't need to be superwomen. We by default are, just by giving birth and being a mother, because it's a huge task. It's an overwhelming task. And this pressure that we have in Western society to bounce back and or have the perfect birth or the perfect pregnancy is putting a lot of pressure on people. So we're going to delve into so many different questions about sort of what you do and how we can impart value to our audience who are listening in today as to how we make the whole process from conception all the way through to postpartum period seamless and effortless in that hope. So how important is it for women to educate themselves about their birthing options?
Yeah, so it's really important that women prepare and educate themselves prior to the actual birthing process and the labour as well. Birth is a sacred experience and a life-changing experience that we really want to protect and keep safe for women. And so women that do prepare and do attend educational classes or do their own research have been shown to feel a lot more satisfied with their birthing outcomes. They feel like they were involved in the decision-making, and they feel a lot more, have a smoother transition into motherhood and the breastfeeding and the postpartum journey as well.
And I think what's concerning is that in the last 100 years, birthing has been very medicalised, and we almost feel that we must be under the care of X number of midwives and an obstetrician, and we need to be in the hospital. We might even feel that we need to go private just in case.
Definitely,
We've become so fearful of what is a most beautiful, most natural process. Definitely. Now, many people, may or may not know, I've had 2 hospital births and I've had 2 free births at home. And both of them were incredible experiences, but by far having, being left unassisted to just be me and
yourself,
to birth naturally the way our ancestors did 100, 150 years ago, it just doesn't compare to the hospital experience I got. Though I would add that my midwives in hospital were incredible. They gave me a beautiful experience, one that, I look back on and I'm very happy with. But unfortunately, that isn't the case for everyone. Some women come out of the process exceptionally traumatized.
Yeah, definitely.
So how important is it for women to identify what birth processes they want before labour even begins?
Yeah, so this will look differently for everyone. What a lot of people do carry a lot of fear, like you said, a lot of fear and a lot of anxiety and stress around labour and birth. And this is because of the way it's depicted in movies, in shows. We're constantly seeing women laying on the back, screaming, sweating, 100 people in front of them like it's a show. So unfortunately, this is how it's depicted in our society. Even when we speak to women, the first thing we hear are the negative stories around labour and birth. So it is very hard changing our mindset, and I think a positive mindset can really change the way you view your birth, and really help you plan for that positive birthing experience that you want. And like I said, a positive birth will look differently for everyone. Some women may have had a very traumatic first experience, and so the second time they may say, no, you know what, I don't want to go through that again, and I want an epidural as soon as the labour process starts, and that will be a positive experience for her.
Right.
So it's really just about finding what's a positive experience for you, working on your mindset, and pretty much blocking out that negativity as well.
Yeah, there is a lot of negativity.
Yes,
You're right.
definitely.
A lot of women will come out and say, "Oh my God, it was the worst.
Yes.
I tore,
Yeah,
and
yeah.
I had stitching done,
Yeah.
and my placenta was stuck to
Yes.
my
Yeah.
uterine wall,
Yeah.
and they had to rip it out, and I hemorrhaged." And someone who's just fallen pregnant would
Yeah,
think,
it's scary. It's definitely.
I don't want to be part of that.
Yeah, definitely.
We need to share more positive birth stories, but the only way we can get these positive birth stories is if these women are actually ready,
Yes.
armed with the right knowledge and tools to go into birth empowered. I remember with my first, I'm not sure about you, I'd love to know your experience. I literally went into labour not knowing much and thinking, let's just see how it goes.
Yes.
I'm just going to give birth naturally.
Yeah.
All I knew is I wanted to give birth naturally, but I didn't know how that was going to happen. I thought it would would.
Yeah, and a lot of people just think, I'm just going to go with the flow. I'm just going to see what happens. But like I said, it's the language around birth too. We really need to shift it from, I'm going to see if I can have a natural birth. I'm going to see if I can breastfeed, to, I'm going to have a home birth, inshallah. I'm going to have a natural birth.
Yes.
I'm going to breastfeed my baby, inshallah, with the will of Allah. So it's really important to change the terminology and the language that we use around birth. And it kind of, for instance, if you're having a conversation with someone using that terminology, kind of makes that barrier that, you don't want to hear the negative side of it. Definitely. Because I've decided myself that this is what I'm going to do. I'm preparing for it mentally, physically, emotionally.
Yes.
And, this is what I want.
Yeah. When I wanted to have the home births, I had my own family members saying, have you lost your mind? Yeah. What if? All the what ifs came out.
The fear.
What if the cords around the neck? What
Yeah.
if, they're purple when they come out?
Yeah.
And I stopped at one stage and I said to my husband, I'm feeling a little bit anxious now. Yeah. And we really had to nut it out again and have a really deep, meaningful conversation to bring us back to calibration and say, no, I've done this already so many times. I know what my body's capable of.
Yes, definitely.
I've already been given a clean bill by my midwife that I'm capable of this, because you don't go into home birthing willy-nilly and go, you know what, I'll just give this a crack.
Definitely.
You go in with all your tools. You go in having been given the tick by your GP, your midwife, whether it be your obstetrician. There are certain criteria that need to be met. If you're a high-risk pregnancy, home birth is not for you.
Yes, exactly. It's actually, research shows that low-risk women with low-risk pregnancies are actually better giving, they have better outcomes giving birth at home rather than in a hospital setting. And this is because of all the interventions and the interferences that happen in the natural physiological process of labour when we enter the hospital system, For instance, I always say the first interference that happens is leaving your home to go to the hospital, because you're in your home, you're in a safe space, you're comfortable, you've got your support system, you're in your comfortable clothes. But when you leave to go to the hospital, you're welcome with new faces that you've never met before. They're asking you questions. They're saying, we need to assess you. We need to do this. We need to put a CTG on to monitor the baby. They probably ask you to get into a hospital gown, which is not yours. Yeah. So we interfere with the natural physiological process of labour. And what it does is your body goes into fight or flight mode. Instead of staying safe and calm and, in your birth zone, you are now in fight or flight mode. Your body is now thinking, how am I going to protect myself? How am I going to protect my birth space? And so it's a huge, I know a lot of people might find it,
it's huge.
Yeah, a lot of people might find it a bit too, what's the word? Confronting, saying that leaving your home is an interference, but it really does play with your hormones and your birthing process.
Yeah, I never thought of it that way, actually. Even leaving your safe space, which is your home, and going into a foreign, sterile environment with unfamiliar faces.
White walls, hospital bed in the middle of the room.
True. And, it's interesting because you're now in the care of people who, you don't know, but you trust because of their profession.
Yes, definitely.
You've got all these white lights around you. Yeah. People are looking at you. People want to do internal examinations. And you're now not in your natural safe space that you feel. And I do sort of compare my two labours in hospital and 2 labours at home. And at home, the lights were dim. Yeah. I had my salt lamps on. Yeah. I had my affirmations on the wall. I had my partner, my husband, sort of massaging and giving me the care and attention. and no one was rushing me, and no one said, "Can I check the heartbeat? And can I insert this?"
Yeah,
and
you're not on a timer there.
No.
You're in your safe space at home.
Correct.
Yeah.
And so I just gave birth like a
As
woman
it should be.
can,
Yeah.
and a woman should, and it was the most
Yeah.
beautiful experience ever.
Yeah.
You know, and I know that it was definitely not the usual experience,
Yeah.
because there is a difference between a home birth with midwives there and a
Yeah.
free birth where we actually had no one
No medical
present with us.
professional,
We
yeah.
entirely believed, trusted in our process, got the ticks of approval from the relevant health professionals
Yeah.
that said your body is ready to do what it needs to
Yeah,
do.
exactly.
And I honestly encourage all women to explore the option. And
Yeah.
if you can't explore a home birth, opt for a hospital birth in a hospital that will provide you with a birthing pool or give you the,
Definitely, yeah.
the,
There's so
the
many,
comforts.
yeah. There's so many options at the moment as well. So a lot of the public systems do offer the caseload program or the private midwifery program, where you have a private midwife follow you your whole pregnancy, and then she'll be on call for your labour and birth as well. So there are a lot of options in terms of where you give birth, how you give birth, in terms of your providers. It's just about finding a provider that you are comfortable with, that you're comfortable birthing with, and that a provider that aligns with you as well. So you don't want to be going back and forth arguing during your pregnancy, because that's just going to add more of a stress load to your mental health and your well-being as well. So we want to reduce it and find people that align with us during our pregnancy. Yeah.
And what are some common interventions in the maternity system that might disrupt the natural labour process, or even, like I notice a lot of women are tearing. Right? They're not quite prepared. They haven't prepared, what would you call it, their cervix or their perineum for labour, which then results in a very traumatic birth that then requires stitching and then sitting on a donut or hemorrhoids. There's so many unpleasant outcomes that can be avoided. How can women better prepare for that period of time when they're giving birth to ensure that it's as natural as possible with minimal intervention?
Yeah, so I always say it's not like the end all if you're going to give birth in a hospital. Yeah, there's ways to make it your safe space and ways to mimic what you had at home in the hospital as well. So I always say create that space for you. Bring your clothes, bring your pillow, your diffuser, your fairy lights. Ask the room, the health professionals, to be quiet and whisper and no unnecessary talk in the room. So, for instance, in my birth preferences, I always mention that anything that needs to be asked can be asked to my support team first, and then if necessary they can come to me and ask me, because I wanted to protect my birth space. And so all of these are interferences and interventions that can affect your labour process, but in terms of interventions that happen in the hospital, for instance, let's say an induction of labour, so there are ways that you can do it to slow it down or make it a bit more of a natural process for you. For instance, before you have the syntocin drip, which is a synthetic form of oxytocin, there are certain steps that they have to take to make sure your cervix is ready for it. So, you could ask to take those steps a little bit more slowly. Instead of having it over 2 days, I'd rather have it over a week to prepare my body for and get my cervix ready for the labour. Before they start the drip, they also break your water. So that's another intervention that happens as well. And, people that have had third or fourth pregnancies, their bodies tend to respond really great to their waters breaking. So you could say, I want to break my waters first and then wait. I don't want to have the oxytocin drip straight away. So there are ways around it. It's just about becoming informed, knowing your options and questioning pretty much everything that you're not comfortable with.
Yes, and that's where you come in, because, as a midwife of so many years, and you educate women during their pregnancy, don't you? So please run through what sort of education you provide.
So at this stage I run childbirth education classes, and we run through all these interventions and all the issues that can arise in a hospital setting, just so that we are prepared, and then so that when we do make our birth preferences, we have all those on there ready to go, in case something does go not as you plan it to go. And I do call it birth preferences and not a birth plan, because when we make a plan, unfortunately, women can feel quite disheartened when it doesn't go that way, and you can feel like you've failed your labour and birthing process. So, we make preferences. So a preference would be, if I was to be induced, I would prefer it to happen this way. And we write down the other options and ways that we can make it a little bit more gentle on our body to give it the time to let it go into labour on its own as well. And so, we run through all of these in my classes as well. And then we go through techniques and breathing techniques and tools, your labour toolkit, that will help you get through those contractions and the early labour. So we pretty much run through all of those topics and a lot more. Just the top of my head, I've
So she's
had
pretty
those.
much goes into labour really empowered.
Yeah.
She knows her options.
Yeah.
She knows what she potentially wants to avoid.
Yeah.
And she makes preferences. And even if she walks in with a plan in her mind, I think it's important to be flexible with those plans
definitely.
because you don't know what's going to
Yeah.
happen. So rather than being rigid and feel like you've failed yourself, be open to change and flexibility
definitely.
with the outcomes, because we don't know. Every birth is quite
Yeah.
unique. Every woman is unique and her circumstances
Yeah.
are unique too. So how can women advocate for themselves when they're faced with pressures to accept unnecessary interventions during labour?
Yeah, so during your labour and birth, it's quite hard to obviously advocate for yourself because you're in your zone, you're trying to focus on breathing through those contractions, and that's why your birth preferences are really important before even going into your labour. And that's why I always say do your education early on, don't leave it to the last trimester, because you want to prepare your mind for it as well. You want to prepare your mind for a positive birth.
Yeah.
So having those birth preferences, mid-pregnancy is a really good option. Believing in them, speaking about it with your support team so that they're all on the same page as well, because when you go into labour, they're going to be your advocate team. They're going to be advocating for you, your doula or your midwife or your mum, your sister. They're going to be the ones that are responding to the health professionals and discussing with them. I also say to use the BRAIN acronym. So the BRAIN stands for benefits, risks, alternative, intuition, and nothing. So what are the benefits of it? What are the risks of it? What's an alternative that we can do? What's your intuition telling you? And then what happens if we do nothing?
Yeah.
So really going through these with your healthcare providers and advocating for yourself is really important as well, because we don't want to be coerced into something. We want to feel like we're part of the decision making process.
Exactly. Yeah. Wow. Is it possible? So you're saying it is possible to have a positive birth in a hospital setting?
Oh, definitely. Yeah.
So long as you've got the right support team, you're all on the right page, you've got your birthing preferences. I actually remember walking with a clipboard.
Yeah.
And going, this is what I want.
And you need to be. You really need to be. I mean, I don't want to make women feel like they have to go up with their guard up and ready to fight. But we do have to prepare ourselves for the birth process, because unfortunately, when we don't, you kind of get that experience will get taken away from us. So we need to protect it.
Yeah.
There's a saying by a prophet, peace be upon him: tie your camel, but also put your trust in Allah.
Yes.
So we need to do the education preparation before, and then we put our trust in Allah as well.
Yeah, definitely. Do you find hospital staff are very responsive and positive about people who walk in with birth preferences and wanting to use a diffuser and fairy lights and what have you? Or do you find that there's resistance to it?
No, I feel like there is a big shift in the way that midwives and obstetricians are working now. When I was working, so about 3-4 years ago in a hospital setting, I felt like it was a little bit more, we were still a little bit more on the fence about it, a lot of the obstetricians, but now I'm seeing a huge change in what my clients are telling me about their birth stories and how acceptive they were of it. Obviously, they're still always going to come in and say, look, these are the risks of you making your own choices, etc. But in terms of creating that birth space and making it a safe space for you, there's definitely they're a lot more acceptive of it. And the midwives in the hospital are there for the women, they are the building bridge in between you and the obstetricians, who are essentially the ones that are outside overlooking the what's happening in the birth room.
Yes.
So, and that's why your midwives, they're there to protect you, they're there to help you throughout the birthing process. So I really believe that they are there to help and honour that birthing process.
Definitely. On the rare exception, you'll get ones that just you don't align with at all, but you've got no choice because you're then in there. But I think on the most, for the most part, they do an incredible job, and they've undertaken that course because that's what they want to do. They want to create change. They want to create positive change for women who are birthing. Now, we've spoken, quite a bit about the birthing process, but I think equally important is the postpartum phase that, again, young mums or first-time mums don't quite give enough attention to.
Yes, definitely.
What would be the best way to phase from, birth into postpartum in the most healthy manner for a woman who's just given birth?
Yeah, I think mentally, physically and emotionally preparing yourself for birth and labour, it really does have a rollover effect onto your postpartum period. So if you've had a positive experience in terms of positive for you, it might not be positive for me or for anyone else, but positive for you. So are you happy with the outcome? Are you satisfied with how your birth planned out? Were you involved in the decision making of your birth? I think in terms of anxiety and depression and feelings after birth, it really does play a crucial role in how you feel after it, because we know that if you've had a smoother birth, your breastfeeding journey is going to be a lot more easier for you to transition into as well. Because, when there are interventions, unfortunately, your milk can be delayed. The baby might not be able to suck properly at the breast because of the interventions and the medications that they've had.
Yes.
So we know there is a layover effect that does affect the breastfeeding and the postpartum journey. And I think really preparing for slowing down, really preparing for being with your body, with your baby and your body, and healing from inside out as well. Like you said before, we do have a bounce back culture. Unfortunately, we are expected to just bounce back up day 5, day 6 postpartum and get on with it. This was probably me with my 2 kids as well. Even with my second, I was a lot more calmer, but I had the toddler that I had to care for.
Yes.
And so we kind of have to bounce back. No matter how much we say, we need to rest, we need to organise that support for us. So, having a postpartum doula who can help you with it, whatever needs you need,
Even meals. I think meals are a huge part
definitely.
of the postpartum period that we don't want to think about. We just want to know we're going to have some meals and be looked after for the first month.
Definitely.
In fact, you know very well, Kamile, that there are lots of cultures that honour the postpartum period up to 30 to 40 days.
And that's amazing.
Isn't it? Yeah. I feel like in the West, we don't really get that. No. We don't really have that community. The way we're living with our families, we don't live with our parents. We live separately. So, there's only so much support we can get. But then you look at other sort of Eastern cultures and you see that the woman is treated like a queen for the entire month. And therefore, probably lesser chance of developing postpartum depression because the support is huge.
Exactly.
Whereas you look at Western societies and we do have significant levels of postpartum. Depression or women.
Even our breastfeeding rates are dropping by 3 months and 6 months because of the lack of support in our culture. So we're forced to bounce back up. We're forced to maybe go back to work, start looking after our family. So we don't have that support to be able to sit back and just breastfeed your baby comfortably.
Definitely. Which you're saying breastfeeding, you're also a international board certified lactation consultant. Tell me, postpartum period, how common is it for a mother to come across breastfeeding issues with her little one?
So obviously, as a lactation consultant, people usually come to me when they've got an issue with their breastfeeding. So I do see it a lot in our community. A lot of people in those first 6 weeks, it's probably the hardest part of your breastfeeding journey, really trying to master the breastfeeding, get a pain-free latch, get baby to open up their mouth wide enough and recover from the birth as well. So we see babies that have had, so mums that have had interventions throughout their labour and birthing process, their babies can take a while to suck at the breast. And this is completely normal. We just need to give baby the time to be able to manage it. But unfortunately, what happens is, we're constantly being told, oh, your milk's not enough, or, baby's not sucking, you have to give it a bottle, or just give it the formula, you're in pain, just let go of it. So there's not that really support or that that culture to preserve the breastfeeding. So we kind of, I see it a lot where women just give up breastfeeding very early on or don't understand the benefits of it for you and for your baby. We know that breastfeeding is amazing for babies up to 2 years. Our religion tells us to offer breastfeeding for up to 2 years of age. So there's definitely benefits there for you and for the baby. But it's just about preserving it.
Definitely. And again, being well informed whilst you're pregnant about what breastfeeding can be like, and perhaps even considering options like, aside from a lactation consultant, eating well and resting well, and maybe incorporating lactation supplements in, or breastfeeding cookies or lactation teas to help with that whole process. But really none of it's going to work unless you're hormonally sound, your mental state is calm, you're not being rushed and made to feel anxious. Imagine you've just had your first child, your milk hasn't come in, and a loved one or a friend or a complete stranger is saying, look, the baby's starving, just get it onto formula. As a vulnerable mum, your emotions are everywhere, your hormones are everywhere, you're frustrated, you haven't slept, you can't even make proper decisions when you're not well rested. What's that mother going to do? Exactly. Okay, just give my child the formula, I'm exhausted. And then breastfeeding rates begin to decline.
That's exactly what happens.
Again, we don't have that supportive community, but also lack of education. A lot of us think it's just going to come naturally. I'm just going to make milk. But we don't. But then putting the milk aside, moving into another category of the latch issue. I remember with my son, I was in excruciating pain for the first 6 weeks, not realising that there was actually a latch issue due to a tongue tie, right, that a specialist picked up on. we didn't know.
Yeah.
And a lot of mums still don't know, although it's discussed more it is now than it was 20 years ago when I gave birth to my first child. So how does a mother identify that there is a latching issue? So she's got the milk, it's fine, she's ready to flow, but the baby can't latch.
Yeah.
What does she do? Who does she resort to?
Yeah, so as a lactation consultant, this is primarily what I work on. So if you were to book me in for a postpartum visit, this is what we go through. We go through your birthing process, what happened during the labour and birth that could have affected baby's latch. How was the birth? How did baby? How was baby birth? Was the baby crying? Was it alert? Was it placed skin to skin immediately? So all of these can have a labour effect onto your breastfeeding journey. So we look at all of these, and then we look at how your baby is responding now. Is the baby opening up the mouth wide enough to be able to latch onto the breast? And so we look at, so while the baby, so when I do go for a visit, I always assess the baby's mouth, see how the baby is sucking on my finger to see if he is losing suction. We check for ties, we check for cheek ties, lip ties, tongue ties. And so these are really important factors that can affect your breastfeeding journey. Unfortunately, a lot of people just give up because it's too painful.
Yes.
Everyone's missed the tongue tie. And then what happens is at 2 months, your milk supply starts to drop because baby is not sucking effectively at the breast. And so a lot of what happens is when women give birth, your hormones are fluctuating, they're through the roof. So you're more likely to have an oversupply in those first couple of months. And then once your hormones start to settle down, baby's not sucking effectively at the breast too, what happens is the milk supply drops. And this is a common issue with the tongue tie as well. So what we'll do is we assess the baby. If you're in pain throughout the whole feed, that's a red flag that your baby's not on properly. If you can't hear your baby swallow at the breast, that's another red flag. But the most important thing is a pain-free latch and watching for wet and dirty nappies. So if your baby's having wet and dirty nappies, that's a good sign that they're receiving milk as well.
Yeah. Oh, painful latch. That was my main issue. I remember I'd sit on the couch and I'd have the armrest on this side, and I would claw the couch as he would latch. And everyone knew Mum was about to start breastfeeding. Get away! She's going to become a lion, because I would just roar.
And a lot of people just stick through this and go with it.
Yes, I just knew something wasn't right. Definitely. Please, mums, also trust your inner instinct, your intuition. When something doesn't feel right, explore it. And sometimes the tongue tie, lip tie can be missed by some midwives.
More often than not, it is.
They're not necessarily trained to see the cheek tie and the lip tie and the tongue tie, which is where people like yourself, who's an internationally accredited lactation consultant, knows exactly what to look for. So sometimes your maternal health nurse, which provides fabulous care, looks at all your the development and milestones, what have you, might miss, is where someone like a lactation consultant won't miss it and will probably be able to pick up on those issues. So isn't there so much for a woman to consider? It's not just about carrying this baby and bringing it earthside. There are so many factors that we need to consider to make this as seamless and as pleasant of an experience as possible. And that's where the roles of so many people come in, like yourself. And it all starts with education during the pregnancy and know what's to come and what paths are going to happen to you, because you don't know at the end of the day. You can wish for the best and prepare. Definitely. So what resources or tools do you recommend for women to feel empowered with all their birth choices? What can they watch, read, attend or see or employ the services of to ensure that the whole process is nice and seamless?
So like today, in this day and age, we use Instagram as our main source of media, as our main source of information. So there are a lot of midwifery-led pages, on Instagram that you can follow, but also making sure that you're attending childbirth education and breastfeeding classes is really important. That would be your main source of education from an accredited lactation consultant or a midwife as well. Having a doula is really important as well throughout your labour and birthing process, because you can prepare your partner or your family members as much as you can, but as soon as that fear mongering or language begins in the hospital, they start to doubt themselves as well, and they might start to cave in and give in to what the doctors are saying, unfortunately. So having a doula or a private midwife, which is even better, have in your support team and advocate for you is really important, because at the end of the day you're in your most vulnerable state while you're in labor,
Yeah.
So it's very hard to be able to advocate for yourself.
Definitely. And what about resources wise in terms of, are there certain pages that you recommend? Or I know you run your own Instagram page, it's, from the womb, and you are, quite actively championing for natural births and pleasant pregnancies and restful postpartum periods and advocating for good latch with babies. There's so many things that you're doing.
Yeah.
That's one incredible page that people can follow. They can reach you via email as well. But is there any books or resources or institutions that you know of that women can?
So there are a lot of books. Rhea Dempsey is a famous midwifery professor who really advocates for a natural physiological labour and birth. So she's a great resource. There's also Dr. Kirsten Small, who is an obstetrician, a retired obstetrician who now focuses on midwifery-led care in women, and she advocates for a natural physiological birth as well. So there are a lot of professionals in the field that are advocating for it. It's just about finding them and using them as resources as well.
Yeah.
There are a lot of websites that we can, not off the top of my head, I can't really remember any at the moment. But yeah, so the main thing would be your childbirth education classes, and then your private midwife or your private doula as well that can support
and
you,
all these
because
books.
they've got those resources as well ready available. So if you had a question, they can go back to those books and resources as well.
I mean, we're in a world of information. It's almost overwhelming to the point we need to sort through what we want to read and what we want to follow and what we completely want to ignore. So we can be bombarded, but with the right, following the right people, reading the right resources, looking at the right websites, and perhaps even videos on YouTube that show and speak about. I remember back when I was pregnant, I would follow Spinning Babies. And that was a great resource.
Spinning Babies is amazing too.
For me back then. And
then, like you mentioned, that's actually a really good one, because that actually prepares your body physically for the labour and process, because we know that ligaments can be caught up, there can be tightness in your pelvic area, and so doing those exercises can really help prepare your labour, prepare your body for it as well.
And particularly employing the services of a women's health osteo, like we know very well, Hume Osteo Clinic, we work with them very closely. Your natural women's health physio or osteo can really help prepare you for labour physically. And there are so many tools at our disposal, isn't there? Really, as long as we make sort of the right conscious decisions, we trust our gut and our intuition, we can do anything. I think we're incredible human beings.
Just with trusting yourself as well, it's a huge part of your labour and birth process. Unfortunately, as women, we're not really taught to trust ourselves. This starts from a young age, from our culture or, from society's expectations. So, when we do fall pregnant, it's very hard to be able to advocate for yourself, because there's a hierarchy system in the hospital. So we feel intimidated advocating for ourselves. So doing that preparation before you start, even seeking therapy if you need to, because it can be really intimidating trying to advocate for yourself in a system where there's a hierarchy in place. Really trusting your body is a really important aspect of your labour and birthing process as well.
We're capable of so much,
yes, definitely.
Thank you so much for featuring on our podcast today. You can find Kamile on Instagram from the womb. She's a wealth of information and resources. You can catch her by email, which we're going to provide on this podcast as well. Thank you for coming out today, sharing your time and your wisdom with us, Kamile, and we hope to have some future chats about women's health.
Yes, hopefully. Thank you so much.
Thank you.
Done.